So Frank, just like you and I probably like to get our fingers and toenails trimmed every now and then, it looks like you're doing the same thing for this cow. Tell us a little bit about the procedures and why you're doing this.
Okay. Well, this is our treatment area. We treat sick cows right here in the chute. We do hoof trimming on a daily basis on all the cows that need a little touch-up, need a nail clipping, or some cows that have some abscesses. That's all done here on that hydraulic table. Cows come in, get laid flat on their side, and we can work on their 4 hoofs that are secured. And we do a lot of preventive maintenance on these cows, some nail clipping, some additional hoofs that are overgrown or so. That's the type of cows we bring in. Now there may be once in a while a cow that has an abscess or a fungus that needs treatment. These cows come in as well, but we do foot baths that helps a lot on funguses, and then nutrition is very important on preventive hoof health.
Absolutely, and it looks like a different style of chute you normally use, but it's a good way for the employees to not only get to their hooves, but also to keep the cow restrained so she doesn't hurt herself.
Right. It's quick, it's painless, and it's pretty safe for the employee as well.
So these cows get the luxury of seeing a veterinarian every week, and you all have standard operating procedures. And tell us a little bit about this area and exactly what you do here.
Okay, this is what we call our treatment area. This is where the sick cows come in that needs special attention, that needs some treatments. All these treatments get recorded. There's treatment protocols in place that establishes how employees need to treat these animals, what dose they need to give of antibiotics, if any, and then it gets all entered in the computer. This is where these protocols trigger a beef withdrawal date, a milk withdrawal date, and that's all happening right here.
And these procedures are put together by not only yourself, but your employees administering them and the veterinarian. So you all come together as a team to put together the best protocol that you can to treat that animal.
That's correct. And these protocols are revised one, if not twice a year. It's a living document that changes as technology evolves, as new products come onto the market, as old products are taken off of the market. It's continuously updated. Yes, it's done by actually 2 different veterinarians that look over this program.
Absolutely. So just like you and I, when we get sick, we get to go to the doctor and get some meds, and the same care is given to your cows here as well.
Absolutely.
So Frank, now we're standing in the maternity pen. And so the cows get to see a doctor, and they get to have their calf under roof, the doctor's care as well. So tell us a little bit about this area.
Well, this is what we call this building, the special needs facility. It has a recovery pen. It has the maternity pen, it has the close-up cows, and it holds the sick cows from the hospital that are separated from the other milking strings. This is the milk that is not sellable milk, so which we throw away. The cows get pulled out on a daily basis and get put into this sanded bedded pack. That's where they give birth to their calf. This is a bedded pack of sand that is renewed on a weekly basis. The cows have room to roam around and find their spot and lay down and give birth to their calves. This barn is under 24-hour surveillance so that we really don't miss anything there from an animal standpoint. Make sure that it's all under control.
It always keeps coming back to the individual care of the cow, and even though we have operations of scale these days, we're still able to manage it down to that individual cow. And we have about 1 employee per 100 cows, you would say, on average on most farms.
That's about right.
And so it's amazing the fact that you even pick up and notice things such as hoof care and hoof trimming.
Right.
And to make sure that these cows have the proper hoof care. So tell us, why do you do that?
Well, it's all about animal welfare. If these cows feel good, if these cows are in top shape, then they're going to produce well, and that's basically what it's all about, making sure that these cows feel good. As these cows walk out of the parlor, we see these cows on an ongoing basis, and that's when we sort these cows out. If we think they're limping a little bit, something that may be a big problem, a month from now. We're right on top of it. We sort these cows out, and on a daily basis, we give them that last final touch to make sure that these cows do not have any serious lameness problems that could cause some pain, some trauma to these animals, and just making sure that they're in good condition.